So Dr. Scholz, we're covering immunotherapy today. Can you explain what it is and how does it work in prostate cancer patients?
Yeah, immunotherapy, Alex, has been sort of the holy grail of treatment ever since the immune system was discovered many years ago. There's been a lot of false starts. There's been a lot of false advertising, over-the-counter stuff to stimulate the immune system. It all sounds good on paper, but it's kind of hard to measure immune therapy outcomes because our immune systems work so silently in the background, fighting off bugs constantly. The achievement in the last 10 to 15 years of actual effective immune treatment is really quite amazing. There's only one product for prostate cancer called Provenge. Sipuleucel T is the generic name, that has been proven to work. And it uses a system that kind of makes sense if you have the technology to pull it off. The company goes after the immune cells that identify cancer cells. They're called dendritic cells. And in a sort of like it's called leukapheresis, but it's sort of like dialysis, where someone goes in and they remove blood and then they put it back in. And they remove these dendritic cells, ship them off to Seal Beach, California, and put them in a vat with a lot of prostate cancer parts, specifically something called PAP and some hormonal stimulating agents. And they sensitize these dendritic cells to go attack prostate cancer. They give them hormones to make them multiply, put them in a bag, send them back to the doctor's office, and then infuse it into the patient. And then those dendritic cells tell that patient's immune system to attack the prostate cancer. That's called Provenge. This type of immune therapy is really only available for prostate cancer. There are many other types of immune therapy now out for bladder cancer, lung cancer, and that use different methods. But for prostate cancer, Provenge is the only type of immune therapy that we have right now.
So why is Provenge the only approved immunotherapy? Can you explain to the audience, we hear about other types of treatments that are in other types of cancers. How come that hasn't crossed over to prostate cancer yet?
I think it will. Many people have heard about, President Carter was almost dying from melanoma spread to his brain, and then he went on a immune-stimulating medicine called Keytruda. There are large phase 3 trials looking at using Keytruda to treat prostate cancer as well. And we have some experience with that type of immune therapy, and it does have activity in prostate cancer, although it's not FDA approved yet. The clinical trials need to be completed. Keytruda works by a different mechanism. Our immune system is in a balanced state where if it gets overactive, people can end up with immune illnesses like rheumatoid arthritis or lupus. And then, of course, if the immune system is insufficiently active, then people can catch cancers and infections. So our immune systems are heavily regulated. What Keytruda does is it downregulates the suppressive effects. So there are forces that are keeping your immune system in check, and Keytruda releases those forces so that the immune system runs more freely. And this is why it's been a popular agent and now FDA approved, I think, in 12 different types of cancer.
What are the side effects of Provenge?
Most common side effect is none. The immune system does work quietly, but a minority of patients, when they get their infusion, will have some fever or chills or some body aches, kind of like a flu-y type feeling that could last for a couple hours or maybe a day. That responds well to things like Benadryl and Tylenol and things like that.
Thanks so much for watching. If you would like more information about anything we discussed today, you can go ahead and visit PCRI.org. And please subscribe to our channel. It'll give you updates on all sorts of prostate cancer news throughout the week.